Have you ever wondered about the air you breathe and the tiny particles it might carry, especially when someone near you sneezes or coughs? Yes, sneezing can indeed transmit tuberculosis germs, but it is important to understand the specific conditions under which this occurs. Tuberculosis, or TB, is primarily spread through the air when a person with active lung TB coughs, sneezes, or even speaks. When someone with active TB in their lungs coughs or sneezes, they releases tiny, invisible particles called droplet nuclei into the air. These droplet nuclei are so small they can remain just suspended in the air for several hours. Unlike larger droplets that fall quickly to the ground, these microscopic particles can be inhaled by others, leading to potential infection. It is not casual contact like shaking hands or sharing utensils that spreads TB, but rather prolonged exposure to these airborne germs in enclosed spaces. The presence of active disease in the lungs is key, as latent TB infection does not pose a transmission risk. To minimize the risk of TB transmission, people with active TB are advised to cover their mouth and nose when coughing or sneezing, ideally with a tissue, and to practice good respiratory hygiene. For those living with or caring for someone with active TB, good ventilation in shared spaces is crucial to help clear the air of infectious particles. Getting tested for TB, if you have been exposed to someone with active TB, is a proactive step to take for your health. This airborne spread mechanism highlights why TB is considered an infectious respiratory disease, impacting the lungs but sometimes affecting other parts of the body, including the kidney, spine, or brain. While sneezing is a less frequent method of germ releases compared to coughing, both actions generate these tiny infectious particles. Understanding this specific mode of transmission underscores the importance of early diagnosis and treatment for individuals with active TB to protect the community. Recognizing that TB transmission relies on these airborne particles helps everyone make informed decisions about protecting themselves and others. By supporting those with active TB in their treatment journey and maintaining awareness of good respiratory etiquette, we contribute to preventing the spread of this serious yet treatable illness. Your understanding empowers you to safeguard your health and the health of those around you.